Hello, my name is Jeremy. I'm a paramedic and current nursing student, and welcome to The Real Truth. Like, comment, and subscribe, and also hit the notification bell so you can get videos. And so let's go ahead and get started. All right, so I'm going to start off with, before you start med surg with nursing school. Okay, so med surg, you're basically going to go over your basic it's the first aspect of nursing that combines fundamentals, and it's also going to combine the aspect of pathophysiology and pharmacology. So all three of them come into play. So, and then you also go to the clinical aspect. So it's a mixture of a bag of a little bit of everything, outside of it being like pediatrics. So the average age is more or less like an adult figure from like 18 to like 90 or whatever and stuff, you know. So for me, med surg was kind of different because I'm coming from the whole paramedic background and stuff. So for us in the med surg, you'll finally be able to do things like NG tubes, do wound cleaning. You'll be able to give meds. You'll be able to do calculate meds. You'll be able to basically hang drips. You'll be able to do a lot of things, and that'll be the first aspect in nursing school that you are able to follow the nurse and actually do things, and then also do patient teaching as well. So in one, it goes into the basic aspect of it, so it can break you into it, and then med surg 2, which I can do in another video, goes more into the advanced aspect of it. But I'm going to share with you guys my personal thing with it. And I believe that every nursing student has that one personal experience, whether it's in peds, whether it's in med surg, whatever and stuff. Mine's going to happen in med surg. So I was in med surg, and I noticed that, like, okay, in a hospital, if they already have insurance, or they're able to pay out the pocket, so there are these patients that's called VIP patients. Okay, so they're not really worried about how long they're in there because they can pay out cash and whatever and stuff. Is a big money maker for the hospital. I worked with, at the time span, a 31-year-old male, black African American male. I am 33, so we were close in age. Man was paralyzed. He had a gunshot wound in lower back, the lumbar area, and so he came to the hospital because while he was paralyzed, he ended up having to straight cast so he can pee. So what that means is they're going to put the tube inside of his penis to alleviate it. So what happened in his case is, because this requires like a sterile technique where you basically, like, you need somebody else to basically hold the area, to clean the area and put it in, and he was doing it himself, he actually had gangrene in that area. All right, unfortunate circumstances, but yeah, so that is, so like, most of the thing is, like, he had like surgery and he had the gangrene removed and stuff. So my problem with this was that as soon as it had it up, instead of basically keeping him into the hospital so he doesn't lose that area, they send him home with instructions because he doesn't have insurance, versus the VIP patient who had 2 weeks of being in the hospital to properly heal. Yeah, it didn't set right with me, but it's the reality of our healthcare industry. So, like, if it's set up for, if you have a good amount of money, you're good, and if you don't, you're not. And let's face the facts, like, him being an African American male, and like, didn't increase his chances. It kind of hit me a little hard because I'm a similar age, and then I have 2 boys, and they're gonna grow up to be black boys as well. So yeah, like, the reality of nursing is and stuff, when you're in this program, is that it's not going to be rainbows and lollipops. The reality is you're doing a job that essentially sucks, but you're doing it to help people out. And you're trying to basically, so in that particular case, they ended up sending him home. Hopefully he doesn't come back with sepsis and stuff, but the reality is it could have happened. He could have had sepsis and he pretty much died. But that's the reality of our healthcare system. But that was just my quick thoughts. If you want, how would you feel if you experienced something similar to that? That the only reason why that they didn't receive the full amount of treatment is because of time, and healthcare is basically ran as a business. Do you think that's fair? Comment, and comment below and let me know. And more content on the way. All right.